local care partnership, I think, it works really well, because in what we've just articulated between the three of us, we've got the sort of the stats and the data and the real life experiences of dealing with this problem, and we've got obviously from the schools being such a big part of the community as well, and then that ability to be able to see that across different community organisations across the geography of the area. So that collaboration came together quite quickly. I think that's obviously one of the strong points of working with the LCP.
Get the sense that you, as an area, as a partnership, you already had those really close relationships between community and statutory organisations, and a link into the community, into the people. So you weren't, it wasn't a standing still start. You already had that in place that you could then build on. How do you know that you've made stuff better? How do you know what the impact of this work is on the people of Seacroft?
I think trying to measure outcomes, especially in things where there was a certain amount of necessity in getting it done well in a way, is often difficult, and especially when they're broader, I guess, social outcomes that might not be immediately apparent. That said, I think we can really, look back with a massive amount of pride about what has and is evident to us. We know that from a staff perspective, as we talked about, one of the outcomes we were looking at the beginning was getting staff more confident and aware of the different types of domestic abuse and how that may affect people, because that came out of those initial conversations. And certainly from the workshops and other things we've done, we can objectively say that staff are much more confident in identifying, for example, coercive control. There's a significant increase in people's understanding and identification of coercive control. We have a really effective, and Amanda, I think, probably talk more about the impact that it's had in the Riot Act program that's been run in schools, to the degree that we're rolling that out much more. We've got community ambassadors working within the community. So we have to have some presumption that those things are going to make things better for people. But I think we're fairly confident that they will. And everything we've done, whilst we can't measure it, certainly feels that it's good, and it's done with so much passion and so much energy, and it's continuing. And that's one of the other things that we wanted this to be, is not a small piece of isolated work. And one of the things that we're trying to continue to challenge ourselves is to say, or certainly I do, how can we make sure this is sustainable? This can't just be a single, episode or project. This has got to be ingrained into what we do constantly as part of the LCP. So I think that there is some success in that it continues, as Amanda's saying. So we see that this is a point to build on.
We're able to have them open and honest conversation with families now. The staff are more confident, like George was saying, to be able to have them, so families know who they can go to, who they can speak to. And we're hoping, as we roll out the videos and the workshops within schools, that will give more open and honest conversations for young people to have with people as well, and staff within schools, which again will break down any of them barriers that families have about they can't talk to people. That we're giving them the opportunity now to be able to speak to people confidentially if needed, or get that support in place.
I'd echo that as well from our staff point of view. Our staff, I'm talking about across the wider collective in Seacroft as well. We can't help people necessarily stop some of these things that happen. What we can do is enable our staff to be the best prepared they can be, the most confident they can be to deal with these situations, whether it be something to do with DV, or whether it's something to do with the energy crisis, or something to do with the health inequalities. That the best we can do is all be trained, which is what happened here, in the same way. So we're as confident as we can be that we are supporting signposting, the best we can.
Do you know what your staff say about this? Are they reporting that they are feeling more confident and they're having, I don't know, deeper or more valuable conversations with families that they come up, that they talk to? So as an unforeseen consequence of this one particular piece of work, do you see that as I suppose a bit more of a culture change across the patch?
Yeah, I think the one thing that strikes me is what George mentioned about the ambassadors, where we talked about, this is a tricky thing to do, isn't it? With a tricky topic, is being able to train local residents who are in spaces and places where they meet other people all the time, and to be able to be confident in spotting some of the things that George talked about, and coercive control, and being able to signpost in the right way, etc. I think that's a huge leap forward. And what surprised me as well, there's so many people. I think there was a list that I sent on to Anna of about 20-25 people who had spoken to, who wanted to be involved, and it might not be appropriate for all those people, but certainly the desire was there to be involved in this, and not on a sort of being done to basis, but more as a genuine partnership. And I think that's what's come through working with the LCP, particularly with George and Rachel, that genuine desire to sort of meet people where they're at and ensure that they have there's some equity in some of these projects and these relationships.